the session on for herself. And so it's my pleasure to introduce Lauren Magoon, who is the Senior Health Strategy Specialist at Dimaji. She researches and develops new strategies to improve access to quality mental health care globally through digital tools. Her work includes building partnership with funders, academics, and implementers to advance these and other innovative research efforts towards impact. And I didn't know this, but prior to joining Dimaji in 2021, Lauren directed innovative, results-focused quality improvement projects at the Institute for Healthcare Improvement, or the IHI, and the National Institute for Children's Health Quality, NICHQ. She served in both project and operational roles, partnering with funders, subject matter experts, and families to design and deliver projects that improved MNCH. Lauren, you're very, very welcome, and thank you so much for undertaking this particular program, which we appreciate. Just wanted to let everybody know that we are recording this session. If that's a problem, do please turn your video off, but otherwise, over to you, Lauren.
Great, thanks, Chris, for that lovely introduction and for allowing me to sort of take over the bi-monthly, monthly, I forgot exactly our cadence now, collaboration calls. And I'm excited to be here today with 3 panelists. We have a last minute addition, which is super exciting, and we'll have them introduce themselves in a second. But just by way of context, what I hope we can cover today is some sort of pragmatic, hands-on lessons from the field and ideas of how community-based and sort of frontline worker, frontline-led community health programs, specifically mental health programs, can use digital tools and technology to amplify their impact. And I'm going to cover sort of buckets of questions in 3 main areas around operations and scale of programs. How can you use digital tools to really, enhance operations and potentially scale up your programs to have greater impacts. Also, some very pragmatics on some learnings from setting up new tech tools and digital technologies in your program, and so some of the ways that you can set yourself up for success and lessons learned in that area, as well as training workers and staff on digital tools. And then lastly, but definitely not least, touch a little bit about privacy and data sort of security concerns, which are often in people's minds, particularly in mental health, given it's a highly stigmatized condition in many places, if not everywhere. I mean, it's important in all aspects of healthcare and data, of course, but I think it's particularly something people like to hear about here. So those are the 3 sort of general themes. And like I said, we'll try to keep it, pragmatic, hands-on, so people maybe can have some takeaways. I'd also like to encourage people, feel free to put questions in the chat. I will do my best to moderate both panelists and the questions. If I can't get to the questions during sort of the moderation, I do really want to try to aim to leave lots of time for Q&A. And I'd also encourage people, as this is a collaboration, we should be collaborating, please do feel free to put in the chat for others any lessons learned you've had in these areas or others, or things you want to share from your own work, because that is super valuable. We are certainly not the end all be all of, knowledge in this area. You all have your own real world knowledge as well. So definitely use the chat as much or a little as you'd like. And we will, like I said, try to get room for Q&A. So to kick us off, I would love our panelists to introduce themselves just briefly, and also not only, sort of a quick personal introduction, but a quick introduction from the organizations you work with for Christy, and the organizations with which you work, or at where you work, for Pauline and Ravi. And so I will kick off with Pauline Pichu-Kuranyai. Hope I said that right, Pauline. I should know this by now. But Pauline, can you just do a brief introduction of yourself and your organization, so people have that level setting?
Yeah, thank you very much, Lauren. My name is Pauline Pichu-Kuranyai. I come from Uganda, and I head an organization, non-governmental, called Nama Wellness Community Center. It's located in the eastern part of the country. So the organization is a community-based organization. So we do a lot of community health programs, and that includes mental health, community-based mental health interventions. And this is what we are going to be discussing about today. Our organization focuses on 3 areas, that is health service delivery, advocacy, and research. So under health service delivery, we do community health workers programs. We have mental health. We have HIV care and treatment. We have supporting government health centers. We have community outreaches and so many other primary health care services within a community setting. And then under advocacy, we work with CHWs to form associations that they are able to really advocate for themselves, to be paid, to be supplied, to be supervised, you know, so it's basically CHWs being in front of everything in terms of advocating for their own better work environment. And for research, we are working on research in the organization. This year, we'll have one paper coming out. I'll be happy to share it with everyone here, if possible. So in a nutshell, that is really what we do as an organization. Thank you very much.
Thanks, Pauline. That was great. And we're excited to have you here to share your learnings. Next up, I'll go to Christy. She's next on my screen.
Hi, everyone. Thanks, Lauren, very much. So as Lauren mentioned, my name is Christy. I currently operate as a consultant. I support socially minded nonprofits, for-profit organizations around the world, similar to Dimagi, for instance, with their programmatic strategy, helping secure funding, helping generally kind of expand impact. Over the last 10, 15 years or so, I've worked primarily in organizational strategy and partnerships in global development, health and technology, and my work has cut across numerous sectors, including kind of a deeper background on the mental health side of things as a previous crisis counselor, but as well as some work around building digital tools for therapeutic interventions and consulting on things like privacy and data security in unique environments. So very specifically kind of in and around the mental health space. That's a bit about the work I do with a lot of the individuals and the groups that I work with. They're implementing partners, they're funders, they're digital organizations supporting in mental health programs like Dimagi, they're mental health implementers themselves. So I've had a good opportunity to see a number of organizations and how they work, and happy to be here and share a bit more today.
Thanks, Christy. And last, but certainly not least, Ravindra Agrawal.
Hi, thank you, Lauren. So happy to be here. Everybody can call me Ravi. That would be easier to say. So I am a psychiatrist by profession, and I am representing Sangat, which is a large mental health NGO based out of India. And although we have done some work in other countries as well, Sangat works across the spectrum, and our focus has always been on coming up with innovative mental health solutions with a focus on reducing the treatment gap. I am personally involved in scaling up of mental health interventions with the intention being that these mental health interventions can be delivered by task share model, that is the frontline health workers implement these in the communities which are underserved with respect to mental health services. And I am leading a couple of large scale-up projects in Central India.
Great, thanks, Ravi. I appreciate you. Once again, I appreciate you all joining me today because I'm excited to hear what you have to say. So sort of in that first bucket of themes around operations and scale, my first question, and I'm going to pose this to all the panelists, is we all know there's a huge need for increased access to mental health services around the globe. So I'd really love to hear how you and your organizations are using technology or digital tools to support improved access to services, care, and support in your operations. So how are you using digital to help sort of advance that goal of increasing access and improving the operations of your organization? So Pauline, I'll start off with you.
Thank you, Lauren. Like I said earlier, mental health is part of the health service delivery focus areas for Nama Wellness Community Center. And we do this through community health workers who are paid. And we are glad that when the ComCare Connect came on board, they were really also very interested in having CHWs or working with CHWs who are paid. Yeah, so initially we're implementing interpersonal psychotherapy for groups using a paper-based model. but then it was really very cumbersome for the CHWs. Given their literacy levels, they had to read and carry tools with them every time they go to the community. And in addition to mental health, they also do other activities like integrated community case management in the community. So it became really very tiresome for them to carry tools along with them every time they go out. We were really very happy that Dimagi came on board last year and digitized the entire IPTG program. So everything from assessment to the time that the client is discharged from the sessions was digitized. And this made it really, really very easy for the CHWs. She only carries the phone in her bag and goes to the community. So from seeing the children under 5, she just moves into sessions with the women, as opposed to the paper-based system where she used to go back, carry the mental health registers, then go back for sessions. So it became a lot much easier for the CHWs. And for us as an organization, we see it as a cost-effective way of implementing community-based mental health interventions, because what we do is purchase mobile phone, give it to the CHW goes into the community, and everything is digitized. She's reminded of what she's supposed to do when and how. In addition to that, the issues of stigma have been reduced, because then the digital system can be used also to offer education, knowledge to the community members, therefore creating awareness around mental health and mental disorders within the community, and the community becoming more aware of these disorders and feeling more comfortable really to express themselves and to inform others they are actually dealing with problems maybe of anxiety or depression. And initially, we also saw that most of the women, that is like our target group, didn't really know that they had mental disorders until they had this interaction with the CHWs. That's when they realized that actually, I have a mental health disorder and it's called depression or anxiety. So it really made the community more aware of mental health disorders, and it reduced stigma within the community, because as the community health worker goes out with her mobile phone, she's able to assess women, she's able to pre-group them, enter them into IPTG sessions. And so instead of having only one person, it's a group of about 10 women sitting together, having similar challenges, coming up with solutions together, facilitated by a community health worker to overcome these challenges. So it's a lot much easier for us as organization teams to be able to implement this program within the community. Thank you very much.
Thanks, Pauline. That was great. I heard some key sort of benefits for the switchover around model fidelity and keeping sure people were doing this right thing when they were supposed to be doing it, reminding of that, some educational components. And I think key thing I hear from it is that this really is helping the workers do their job, and it's still a worker-led human intervention. The digital is just sort of helping move forward, which I think is often a great use case of that. Awesome. So I'm going to move on and ask the same sort of question of Ravi. I know in your work at Sangath and a lot of your work just generally, you're using digital tools. What are some of the ways that you think they're being best used to sort of support operations and or access of care?
Sure. Thank you, Lauren, for that question. So because I did have some time to think as Pauline was answering the question, so we actually we can categorize the way we use the tools either in training, then in delivery, and also in monitoring, and at the same time also as a therapy aid. So in terms of training, what we have done is the same, like how Pauline mentioned about the interventions being digitized. So we have got the like we have an intervention for depression. We also have interventions for perinatal depression. We have digitized these interventions, basically converted these the manual content into role play videos, and these role play videos are now embedded onto a learning management system. Something which can be accessed by the lay health worker, by the frontline health workers through a smartphone. And the advantage of doing that is that the training doesn't have to be done face-to-face now. They can do this training from the comfort of their home. They can do this training at their own pace in the free time which they have, so there is no pressure. And obviously, this actually brings down the cost of the training significantly, because now from the remote areas, the workers don't have to travel. And sometimes they have to travel half a day to reach the training site. And then after a couple of hours of training, then they have to go back. Otherwise, they won't reach home in time. Now, having delivered this training through an LMS, through their own smartphones, makes it much, much easier. Other way we also use the training is that we have an app called the Peers app, which we have developed with the help of Dimagi. And what this app does is, when the lay health worker is actually delivering the counseling session, the app actually records the counseling session and uploads it in an anonymized way, in an encrypted way, to a cloud server. Then the supervisor is able to take that recording out and then use the recording for what we call a measurement-based supervision. So basically, in the supervision group, then the whole peer group listens to the recording, and they actually then comment on what went right and what needs to be improved. We have also got another tool called PracticePal, which is actually a chatbot, and the chatbot engages with the client in between the therapy sessions. So basically what happens is, in between two sessions, and often what happens is, in a particular session, the therapist would suggest certain activities to the client, or would give some homework. And the evidence is that if the client engages in the homework regularly, then the outcomes are always better, and they kind of get much more advantage from the therapy. So this chatbot engages with the client in between the therapy sessions, prompts them about their homework, and also prompts them about the learnings from the previous session. So this is the way in which we are using the digital tools at the moment.
Great. Thanks, Ravi. That was super interesting how you framed it in the different, sort of aspects of your programs. Christy, sort of same question. Do you have anything to add to build on that you've seen in the different programs you work with around, digital for access and or improved operations in that regard?
It's an awesome question. And I think between both Ravi and Pauline is kind of a masterclass in how you can use digital in mental health. Thanks for that. I mean, I've seen loads of tools. The one thing that I think is really interesting sometimes is to pair it back to just the main principles of whatever technology can do in any health program, it can theoretically also do in a mental health program. So like starting in for base level around like data collection in the most simplistic form, like technology at the moment is used really well and really nicely for data collection and other programs. Can you streamline your PHQ-9 screenings, your HODAS screenings? Can you streamline demographic data collection? Can you create things that are more efficient down the pipeline of analytics for your M&E team for further programming? Can you use it to manage cases across multiple times? I think there are these little gains that, I'm sorry, not little gains, but gains that you can make by deploying relatively simple digital tools that would help create a more efficient mental health program and or create an opportunity for a frontline worker to gain efficiency within their role, whatever that might be, help with the program itself. And I think that kind of from a base level principle is like a step one sometimes in a lot of mental health programming. I think sometimes we think about digital and mental health, we start thinking about chatbots and tools and AI bots to support mental health programs, and they all have their place and it's all really, really wonderful. And I think that if we can use the digital tools out there in this world to solve even additional percentage of providing care for people that can't normally get it, then we should, and that's wonderful. But sometimes when you're kind of starting off with digital and you're starting off with figuring out how it can plug into mental health programming, going back to kind of those first principles of what can like the most simplistic technology do, and then building upon that from there. So starting with things like data collection and case management, and then building into things like maybe job support and frontline worker support and well-being support and chatbots and client support and all these different types of things, and start layering on different elements and aspects of digital in order to create a more comprehensive solution. I have a few other thoughts to add, but I think I'll just pause there because I think Ravi and Pauline covered them really nicely already.
Awesome. Thank you, Christy. And I liked that. So that was a great bringing us back to sort of core principles, which I really appreciated, as I think everyone did. So moving on, and Ravi already sort of briefly touched upon this, I'd like to talk a little bit about training. And I mean this in sort of two ways, both training workers on the whatever they're delivering, whether it's IPTG or psychosocial support, whatnot, and how digital might be able to help that. And Ravi touched a little bit about that Sangath is doing that in their Empower program. but also training people on the technology itself. A lot of people, both Pauline and Ravi, work with frontline ASHA workers and community health workers and frontline staff who have various levels of tech savviness. And I'm curious if you have any takeaways or tips on how to sort of, this is a double-barreled question, I apologize, both help, digital might help support the actual training of content, but also how you've helped train your workers on the actual digital tools. And maybe you take one or both of those, whichever you think you have the most to say about would be fine. And Ravi, I think since you brought up training originally, I'll actually push it back to you. Do you have any thoughts on how you've been training either the ASHA workers on actually using the digital tools or if you want to say more about your actual online training for delivering care?
Sure. I'm going to start off with Ravi's rule. And the Ravi's rule is that when it comes to digital tools or digital technology, we always land up underestimating our kids' ability to do that. They are always so smart. We think they want. And when it comes to adult learners, we always overestimate them. So basically, no matter how simple a digital tool may appear, adult learners may say, okay, I'll be able to do that, but they always fumble. So this is something which we learned on the job when we were doing the trainings. So what we have learned to do is that whenever we are rolling out any trainings, we actually, no matter how simple a tool, we actually set an orientation workshop for them, a 2-hour or a 3-hour orientation workshop, where we literally handhold them into how to navigate the digital tool. And that is a big learning which we have had, because previous to that, we would kind of deploy the tool. It seems simple enough for any adult learner to be able to use, but they always used to fumble. So that's one learning which I would like to share with you guys. If you would like to, whenever you do, is that always have an orientation workshop. And of course, and then follow it up later on with troubleshooting. Expect them to get stuck, especially when we realized when it was for digital tools and also for the app for the recording of sessions, they always kind of misunderstood the instructions.
Thanks, Ravi. That was super helpful, and I think resonates with our work at Dimagi and other places as well. Not assuming is usually a good thing, and I love Ravi's rule. That's some lovely alliteration too. And how about you, Pauline? I know you've rolled out newer digital things in the last year or two. I'm curious how you went about doing that, and any lessons learned on sort of implementing a new technology with your workers.
Yeah, so what we did was to start with the CHW supervisors, a few of the team members, have them train, have them understand the application and be able to use it. So by getting that kind of acceptance from the supervisors, it became very easy for us to translate this to the level of the CHWs. And the good thing is that our CHWs were basically using paper-based systems for everything, IPTG, for ICCM, for WASH, for everything. So when they saw the digital system, they became so excited and very interested in it. So each day they were really very interested and willing to learn more about the system. And that was really a positive thing for us as an organization. So having trained the supervisors, then became very easy for the supervisors to have time with a few of the CHWs and transfer that knowledge to them so that they really understand the tool. And also what we did with the team at Dimagi, we used to have at least weekly meetings just to catch up on how things are going on the ground. And we also have like a feedback tracker. We could put in our concerns, suggestions, ideas in there, and they use that really to really create a tool that was user-friendly for the CHWs and the supervisors as well. So it became a lot much easier because we had support like from the Dimagi team. Then the trainers also were really very ready and available to train the CHWs. Anytime they could call, the team was there to support them. And then there was also this hands-on training that took some time. We really brought them on board and did the hands-on training. They used the app and they were really very excited about it. So that frequent engagement with them really made it very easy for us to implement it in the community. Yeah.
Great, thanks, Pauline. That was super helpful, awesome. And Christy, do you have anything to add to that you've seen? It's good about helping train.
Yeah, I mean, the only other thing to add, which I think we kind of allude to and we talk a lot about, is just whatever you're going to train on, whatever it's been developed, ideally it's been developed with the end user in mind, right? So you've developed a tool with engaging with frontline workers, with clients, with whomever you're actually going to be delivering that tool to, that whoever's going to be using that tool. So I mean, you're going to run the trainings themselves. You're training individuals on something that they've already consulted on, and or individuals who are doing similar work to them. They already kind of know what they should be using the tool for. So hopefully you've designed it in a way that is as intuitive as possible for someone who's engaging in the environment, especially maybe someone who's never used a phone before, who doesn't have a concept necessarily of like what a cloud is in terms of like where data goes, or like how do you take those pieces and elements and you break them down in a way that has been like thoughtfully kind of done such that someone who doesn't have that experience has the ability to intuitively work through the application. So I think some of those pieces around like designing with the frontline workers, specifically starting kind of from, again, some of those first principles of like, how do we kind of build the thing from the ground up, hopefully should kind of make that space around training more, a little bit easier. But that's the only thing I have to add, is kind of the more on the design front, less on the training front.
Lauren,
Yeah.
if I'm
No, please go ahead. Go ahead, Ravi.
Just kind of got me started to think about what challenges which we were facing as we were rolling out the trainings. So again, and I'm going to say this from the perspective in India, but maybe similar in other countries as well, is again, often the smartphone which is used for using the digital tool is sometimes the only smartphone in the household. And everyone is using that. That basically means that there is not much storage space left on the smartphone for our videos, which we ever do. So one of the things which we learned was that if our intervention required accessing videos to learning, we often also give them a memory card, so that with our videos loaded on that, so that, our data is protected. It doesn't, otherwise somebody else is using it, just kind of delete your videos to create space for whatever app or whatever game they want to play. Another thing which we also realized was, look, I've lost my train of thought now. Let me come back to you, Lauren, when I remember what was that.
Yeah, no, absolutely. And I think that was a really good point, Ravi, of that. I didn't have really a question about this, but like when you're thinking about like, oh, maybe we should use a digital tool technology for this, really thinking what your users need in advance, which sounds like super obvious. And I don't think everyone always does it. And things like if you're using a tablet, for particularly people in lower middle income countries or lower income countries, the capability of the phone or the tablet, which is usually what we're talking about, those settings. Occasionally it might be a laptop, like how much storage it has, how often do they have Wi-Fi connectivity or cellular service connectivity, download, upload speeds, and sort of the tech savviness of the end user to be able to go through multiple apps potentially or multiple screens, and whether the tools, can sort of handle that need, and or how can you actually build training to be able to overcome those obstacles, and knowing that in advance. And I'll also just put a plug on, if we have any funders on this call, occasionally we do, allowing people the time, space, and money, if you're funding such projects, to be able to do this training and upfront sort of formative stuff, really, really sets up these programs and projects for much better success than sort of shorter term or no money to do training or upfront testing as well. So I'm not sure any of your funders, but I'm sure those of you who are recipients of money, I'm preaching to the choir, but just want to put that out there. It's a real need. Yes, and funding for innovation. Thank you for Caitlin, who put that in. Is sometimes doing funding for pilots and small scale things to see if these things really do work and can then become cost effective is also often really, really important. Cool. So sort of along the lines of training, I know a lot of people, I think right now, we're not going to really go into AI and sort of more futuristic things right now, but I think a lot of people right now, as I in my day-to-day are talking to people, are thinking about what tools they have now and whether they should switch or add things. So I'd love to hear from our group some best practices beyond what we've already said around kicking off a new project. So besides training, is there anything else that really gets an organization ready to start a new digital or technology program that we haven't already alluded to? Maybe not, but I suspect there may be some other things you've learned as you kicked off new things that might be useful for our audience. I will start with you, Chris. What do you think people need to be thinking?
Sure thing. Patience is probably the first thing that someone needs. I think that I would start that people tend to overestimate the change that occurs in the first year and underestimate the change that might occur in 5 years. And I really resonate with that. And I think especially that's true with deploying digital tools. If someone's deploying technology for the first time in their programs, there's oftentimes people tend to look for like a silver bullet. They make a list of, here's the 15 problems we have. Let's find the thing that solves all of these problems, right? And I think that creates a tendency to look for either the newest, the most flashy, the most, the thing that can go through the laundry list. Okay, I'm going to solve all of these issues. And I think oftentimes there are elements that people aren't thinking through when they take on this new tech. So to get more specific, stuff that I'm thinking about is like underestimating the long-term support required for digital tools, right? So thinking through kind of the sustainability perspective, an acknowledgement about kind of the investment that it takes, both financially, but from a resource perspective, from a training perspective, what kind of changes it could make to your program, and whether or not you want those changes to happen. You can't just kind of slap digital tools onto something and say, hey, go make it work. You have to think through kind of what are the pieces that I'm preaching to the choir here, but what are the pieces that need to change or adjust in order to make sure that you're creating a program from like a very thoughtful, user-centered and client-focused way, especially in mental health. Like, how can we leverage what we're using in a way to the most effective way possible? And of that laundry list of 15 problems, what are the top 5 that we think this technology is really going to make changes to? And how do we create a program that allows us to do that? The other kind of pieces that thinking through is around, from the technology perspective, how does it operate 2 years down the line? How does it keep up with the latest technology? Who's running it? Who's running the cloud? How long has that team been around that's actually doing the deployment of the technology? Are they training your team on it? Do you have the capacity to be trained on it? And then how are you going to troubleshoot problems? I think all of these kinds of pieces, when you're thinking through, okay, I'm going to pilot this really new cool thing, you want to take it to that next step and actually plug it into your program and your implementation plan and say, this is going to be a part of it for forever. How do you really think through those components when you're thinking about kind of deploying these elements of technology and making the right choice for your organization? And sometimes the right choice is no technology at all. And acknowledging that as well is also really important too. Those are just a couple of thoughts that are kind of running through my head on this. I'm going to think on it a little bit more, but I'll pass it over to other folks.
Yeah, no, thanks, Christy. So to reiterate, I was curious I'll put it to Pauline first, then Ravi. When you are kicking off a new technology or digital tool in your organization, what are some of the things you've learned, if they haven't been mentioned already, that has helped facilitate, the adoption of it and it's real, getting the most impact out of that tool?
Yeah, so for me, the first thing was something that Christy mentioned, involvement of the end users from the start. Yeah, having the end users involved from the start is very key, because then it promotes this acceptability within the team to be able to use the tool. And then the other thing is, I know most countries are now rolling out community health information systems. So I'm just curious if there is a possibility of having integrated systems, like Dimagi develops a tool, then maybe another person develops a tool, and then the other one also develops a tool, and then you find all these tools are going probably to the frontline health worker, all the 3 tools. And most times you find these frontline health workers not really giving you feedback and telling you, by the way, I have another tool I'm using right now. So they keep quiet because they know there is a monetary benefit to that. So they keep quiet, and before you know it, they're having 3 different tools they're using at the same time. So it becomes really very complicated, like for us to work with them within the community to streamline that. So I think something that can be considered is to find out if there is really something that's happening on the ground, and if it's there, how can we work together collaboratively with the other inventors or vendors or something like that. Yeah, but good enough for us, we didn't have any tool. Right now, we are having the electronic community health information system, and I'm glad that each CHW is having a mobile phone, and we are free to actually include the app there so that they can have one phone doing several things at the same time. Yeah, so that's something that we are right now doing at the organization. So if that can be considered even for other countries, I think it really relieve the CHWs of too much workload and having to hide information from organizations, you know, when it comes to implementing some of these activities. Thank you.
Thanks so much, Pauline. And Ravi, do you have anything briefly to add about kicking off projects?
Yes, you said briefly, so I'll stay brief. It's about context. I think one of the things important is your content should be context specific. Otherwise, it's not really acceptable. And we kind of heard it, we kind of learned it the hard way. We recently rolled out a resilience app, and for that, we had got some amazing videos from the YouTube, which we kind of put in there. And, however, our users said, you know what, that those videos look very foreign to them. So that context is there. Second is about when every digital tool, what we're going to be talking about, ultimately we want it to be scaled up across the country. We want the policymakers, the government to actually roll it out. And we have to be aware of that. The moment it goes to that large extent, it's not going to be that closely monitored as the research team does it, as the team which is developing it. The team which is developing it knows all the features, and they have kind of done this 100 times in their heads. They know exactly where, but we have to plan for it to be simple enough that when the government is going to roll it out, the persons who are going to be in charge probably would have got only a few hours of training. So unless and until the interface is simple enough, even at the back end, if it's not simple enough, then it's going to meet trouble.
Thanks, Ravi. Yeah, no, that's super important advice. And looking at the time, and I want to make sure we leave Q&A, I'm going to go on to our last question around sort of data privacy and confidentiality and using technology with our clients. We've been talking today primarily about tools for the employees or the frontline workers or the organizations, but that, you know, that information is of the clients and beneficiaries. So sometimes that comes up. So I'd like to put it to Christy first. What are some of the issues around privacy and data confidentiality that you've seen come up sort of in these programs, and how can programs, you know, ensure they're sort of, you know, doing this well, and also how can they potentially talk to their clients who may have worries about like doing online screenings or, you know, someone keeping this information on their phone?
Such a great question. Many questions in terms of the system itself. No, I know. I mean, with privacy and data security, it's like we haven't really cracked it yet, I think, but we're getting there. And similar to Ravi's rules, there's a couple of like rules I have in my head in terms of when you're thinking about privacy and data security. You know, what are the top few things that you should be thinking about, just from like I keep saying this, like a first principles or like a basic point of view. And for me, there's 3 things that always come up. The first one is data minimization. So only collecting data that you genuinely need for the program. Like, what specifically are you looking for? Do you need to know whether or not this person's married? What difference is that going to make in this instance in how you're engaging with this individual? Do you need to know their age? Do you need to know all these pieces? And really thinking through every piece of demographic information that you're collecting from them, and anything else. Do you need to collect it? And if so, what's your justification? A lot of data, of course, in mental health is inherently confidential, right? And so you need to figure out how can you support that confidentiality by only collecting the things that you need, but also enough information, of course, that you can triage if needed, if that individual is posing a threat to themselves or to individuals around them. You know, how do you navigate that environment? And that kind of comes to my second point, which is communication with the client, thinking about kind of consent around both data collection and what you want to do with that data. And I'm talking about like genuine informed consent, which actually is very, very difficult to get because it requires someone to really truly understand the depth of where that data is going and what it means to have your data collected. And I think that's a very difficult thing for a lot of folks, you know, to understand when I give someone my name and my phone number, what, where, how, when is this being used? What's the cloud? Why is it living in there? I thought clouds were in the sky. This is ridiculous, right? So if someone is like having a conversation about digital systems and tools, how do you create an environment where someone can truly understand where their data is going and how they understand it? And I've worked with a couple of very cool organizations that have thought through creating an opportunity for informed consent with individuals who've never even had a phone before, through things like storytelling and plays and radio advertisements and all these types of things. Like, how do you kind of paint a picture to make it really clear? This is where your data is going. And this is what would happen if you said, hey, I want my data deleted. I want it gone. I want that data back to me. What does it mean to be a data owner? Like, all of these pieces, I think, are really elements that you need to think through. So thinking creatively about informed consent and thinking creatively about things like layered consent and audio consent and elements like that. And then the last piece is data storage. So what do you do with the data after it's collected? Where does it live? How do you handle it? Does it live on the phone? What's the protocol if the phone gets stolen? Who has remote access to delete it, for instance? Does it live in the cloud? Is it on a local server? Are you working with a third-party provider who has a long track record of securing this type of data? If it's a local server, what's the infrastructure look like? And some kind of like key tips in this area is to make sure that all the data that you have is pseudonymized. So making sure that you remove any personal identifiers when it's actually loaded up into the cloud or wherever it's stored, and replacing them with placeholder values. So God forbid, if your system gets hacked, someone kind of peers in and is like, okay, well, this is a really long string of numbers, and they can't necessarily tell that, oh, hey, you know, Christy had, you know, presented with this, and I can find her at this address, right? You have placeholder values in order to ensure that you're protecting someone's data as much as possible. So it's definitely not easy. There's a lot of complications that come with it, and especially in the mental health space where there's stigma associated, and you have to ensure that you have enough information to intervene when they're really critical cases. But it is stuff that we need to be really thoughtful about, and we need to do our best to get right. But luckily, I think the mental health sector is not alone in this, and we can definitely pull learnings from every other health sector out there in terms of best practices and making sure we implement them in our own programs.
Awesome. Thanks, Christy. I always, whenever I've been on other panels with Christy, and always ask her this question because I always feel like it's a masterclass in thinking through these really, really complicated issues that some organizations gloss over more than maybe they realize they are. And it is such a important thing to understand. Pauline and Ravi, do you have anything that you feel you must add to that, or can we move on to Q&A?
So I think Christy has given a very comprehensive, and I'm glad this call is being recorded, you know, because that's very grateful, Christy. I just have a couple of things to add. One is, going forward, again, plan and prepare yourself to meet with some paranoia. And whenever you are going to take it to policymakers, people are going to be paranoid what they're going to be doing with their data, with data security. So be prepared with your answers. And again, for those of us who want to kind of work with digital tools, please budget for data security. Often we budget for all the creativeness, but we don't budget for because those are the expensive parts, the audits and the processes and the encryptions, and these do take, and it's important to actually budget for this. And also, especially if it's a research project, do talk to your collaborators in advance, specifically if the collaborators are international, because increasingly the countries are becoming very cagey about the data. They don't want the data to leave the country. So like, for example, in case of India, there's now a rule that all data has to be kept on Indian servers. So it's important when you're discussing with the collaborators that you let them know that the data will not be able to kind of leave the country.
Maybe to add, sorry.
No, go, Pauline. Go, please.
Yeah, so they like for our case, we have a data protection certificate. So we went through the entire training, and that team came down and supported us, and were given a data protection certificate. So that means that actually we are complying with the data protection procedures in the country. So it's very important to have that, because then it builds this confidence within the community itself, and also at national level with the concerned parties or authorities, that actually you're complying to those processes. So it's really very important to have that data protection certificate as an organization. And also, like for the IPTG, the app, it's basically, it has a password. So I cannot have access to that information unless if I'm a CHW supervisor or I'm the one who is supporting that particular CHW. So there is a password to it. So even in the family, like even if someone is playing with the phone, it's only that CHW has access to that information. And once this information is submitted into the server, it's erased from the phone. So no one has access to it unless if you consult the people in charge, then they can retrieve it. So that is also another measure that is really helpful in maintaining confidentiality for this information. Yeah.
Thank you, Pauline. That was great. So we have about 12 minutes left. So I would love to turn it over to the audience for Q&A and or anything, you know, if anyone has anything they want to add to what we've said or lessons they've learned, we are certainly open to learning from you all as well. So you can raise your hand, put question in the chat. Any of that is fine.
Lauren, we have Lubna.
Oh, yes. Go ahead, Lubna.
Thank you so much. Just a quick request, maybe. I work on several ethical AI standards, one of which is soon to be released, finally. We've been working on it for 5 years, on empathic AI. And empathic AI obviously has a significant link to mental health, I believe, and we work on ethical consideration of using empathic AI. So a couple of things are happening now that we are about to release it. We are organizing several sessions. We are also working on technical submissions, papers that would in relating to this, so that we can start expanding, because empathic AI is actually used a lot. And even when you talk to ChatGPT or anything, when it sounds like it's listening to you and relating to you, all of that is ways to either nudge you or manipulate your behavior, whether it's to make you feel better or even to get you to vote for someone or whatever. So I would love it if if any of you would be interested in learning more or in participating in one of these papers or even one of those sessions that we are hosting. We're even doing something with ITU on the series of the AI for Good. So if there's any interest in that, I certainly would be thrilled to have participation from any of you who are with a focus on mental health, obviously. I think it would be phenomenal, and I would be grateful. And thank you for this.
Thank you, Lubna. Put your email address, Lubna, into the chat so people can get in touch.
Yep. And we didn't intentionally, actually by design, touch on AI today, keeping it pragmatic. Hopefully in the future we'll be able to do one on that topic. We are doing a fair bit of it at DMAGI, not necessarily mental health specifically, but in the sort of health and development sector. So you can reach out to us too about that, and hopefully more to come to the collaboration on that topic. There was a question in the chat, and then I'll get to you, Manoj, if that's okay, earlier about online classrooms and classes, and how do we get people to adhere and sort of complete the training, is what I'm reading from that question. And I'd actually ask Ravi, because I know Sangath has done a lot of online trainings for their workers, both in the US and actually affiliated programs in India, and some affiliated work in the US, what you've learned about keeping people to actually finish those programs, the online trainings.
Yeah, I mean, that is a challenge, which I'm sure everybody has come across. And the way we have tried to circumvent that is by keeping the trainings very engaging. So like everybody who participates in the online training, as many of them, we kind of ask them to kind of respond. We call them out and ask them to kind of contribute to the discussions. So that way everyone is aware, okay, I may be asked next. So that person then ends up constantly paying attention. But that is for, that however applies only to synchronous online learning. But if it's asynchronous online learning, when you're looking at pre-recorded content, then obviously the way to do it is maybe after every few modules, you have a check-in contact session through which you kind of keep them engaged in the trainings.
Yeah, that was great, Ravi. And I'm not sure anyone, a while ago at Dimagi internally, I actually did a bunch of research for internal purposes on online training. And I'm not sure anyone's truly knocked this out of the park yet, really keeping people finishing asynchronous online learning. There's some, I think, mixing up the sort of content delivery you have from videos to reading stories, and really forcing people to respond actively in different ways. So not just have multiple choice questions, have questions where you pick amongst, I've seen ones where you have to slide things in order or have to click on different parts of the screen, keeps people mentally a little bit more engaged. But I'm not sure there's like a end all be all to being able to do, keep people online. And Manoj, you've had your hand up.
Yeah, Lauren, good to see you again.
You as
Great
well.
moderation. Thank you. And thank you also to the panelists for their sharing their insights. I'll try and ask this question as sensitively as possible. But, when we talk about digital tools, I do wonder if it presents any challenges for the end users who might be going through some mental health challenges in terms of, their acceptance of tools or acceptance or and so maybe Dimagi has an answer and you can answer that, or maybe one of the panelists, but I'm curious just to, how much of a challenge is that?
Yeah, so I'll just briefly jump in and say the things we were talking about today mainly were around the front, like the CHW or the clinician using the apps, which has different acceptability, usability problems. But for client-facing tools, it's a really great question. And we, I don't think, Pauline, do you use any client-facing digital tools where the actual, the people in your community are using technology?
No.
I was just checking. So Ravi has been testing some in India. That's he mentioned it in passing a little bit, a tool for the actual client, beneficiary, patient on their phone, which is a chatbot. And Ravi, what have you seen so far on what the patients think about it? And tell us actually what the patients and clients actually, like their background.
So again, to kind of sensitively respond back, I am assuming that we are not assuming that clients with mental health challenges don't have the capacity to understand. I mean, we should not automatically assume that because there is a mental health issue happening, that they are not capable of benefiting from a mental health tool. That said, one needs to, at the time of the design phase, one needs to keep that in mind, that the content is simple enough, that the content is not triggering. And at the same time, especially about the chatbot which you mentioned, which we are testing, the content is intended to reinforce the learning which happens in therapy. And through simple videos, not very long, and no content, I'm repeating myself here, no content which is triggering.
Yeah, thanks, Ravi. And I think what you're asking is hard, right? I mean, and we at Dimagi generally have been thinking about our tool as a supplement to people-led interventions in some way. So to reinforce what they're learning in therapy or in learning with their, CHW or whatever that program looks like in that context, which isn't to say I don't think there's any room for completely digital interventions. I think there can be, particularly if you're talking about building resilience or well-being or self-care for a general population or people with a very low, a mild level of, depression, anxiety, and such like that. I have not worked on, and it may exist out there, like standalone apps that are really for people with severe mental illness or disorders. Like I said, they may exist, but it's not something.
And Lauren, if you don't mind, I don't mean to hog this space here, but I just want to share an experience that I had recently with an innovation organization that's created an app to help. It's more gamification, but it's an app that allows you to identify triggers, what might cause a trigger for you for anxiety or something else. And they shared with me that sometimes they found that the triggers actually exacerbated the problem in the moment rather than actually help them appreciate or have a better understanding of the underlying causes of the anxiety. So they were trying to be careful, and they've been actually forced to, therefore, not forced by anyone else, but by themselves, to modify the content. It's back to what you were saying, Ravi. You've got to be careful with the content being sensitive and reinforcing rather than exacerbating. So that's the reason I asked the question, whether that was just a one-off I heard from that organization, or is it something that's more widespread?
Yeah, it's good to know the context where it was coming from. Yes, yes.
Thank you.
Any other questions in the last minute? And I will put my email in the chat. I will not, anyone else can do so or not as they would like. If people want to reach out and ask questions, I'm happy to try to field some. And I want to thank you all for coming. I'm not seeing any other hands right now or questions. So on behalf of the panelists, thanks so much for your time. And I hope you all learned at least something or enjoyed yourself, one or the other, during this session. And thanks to Chris, who I'll hand it back over to close out, I think.
Thank you very much indeed, Lauren. What a wonderful session it's been. I'm amazed. It's already, the time's already gone. It's so it's just it just shows that when the time goes fast, the session is good. I just want to add my thanks to yours, Lauren, to you, Ravi, Christy, and you, Pauline. And looking forward to meeting some of our panelists in person in a few weeks' time. So that'd be great. And Lauren, thank you so much indeed for getting us organized. Really, we really appreciate it. And want to wish everybody a very good day, and thank you for coming. Take care now.